from Louisiana, Representative John Fleming, to begin that discussion, or any other comments that he wants to make before we get into that, and I yield to the gentleman.
Thank you. And I did want to enter in a couple of ideas before we move right into that. You know, Mr. Speaker, the other side of the aisle oftentimes says to us, well, now, you Republicans, you want to repeal Obamacare? You mean to say that you want to stop what is in it in terms of increasing insurance coverage up to age 26? Do you mean to say that you want to bring back pre-existing conditions that would prevent some from getting health care coverage because of chronic disease? Do you mean that you don't want to see insurance expanded? Well, of course not. We don't want to see those things return. That is to say that we don't want to see, once again, that kids up to age 26 for some reason can't get insurance covered by their parents. Of course we don't want to see that. And certainly we don't want to bring back pre-existing illnesses as some way to block people from getting care. Those are all things that we, on both sides of the aisle, can agree on. The problem is that the structure of Obamacare that is so steeped in bureaucracy and so costly and so, I guess, handcuffing, if you will, of health care in general, health care decisions made by doctors, by the patients themselves, that's so difficult that what you're really getting is a situation where you're throwing the baby out with the bathwater. The few benefits that are in Obamacare are certainly way outweighed by all the problems. So, of course, we would love, after repealing Obamacare, to bring back some of the things that we in this floor may have unanimous agreement on, and that is never again will we see pre-existing conditions that would block someone from getting health care coverage. At 26,
the gentleman will yield to me just for a second, and of course,
yeah,
in regard to that last comment, Mr. Speaker, the gentleman made in regard to pre-existing conditions, and Dr. Brown referenced it just a few minutes ago on his 4 common solutions, common sense solutions, in regard to those high-risk pools that the states can create, can set up, can say to health insurance companies, whether it's the Blues or Aetna or Cigna or smaller companies. There are literally 3,000 health insurance companies across the country offering policies, not just these big, huge mega companies, but to say to the ones that are doing business in your state to have to abide by a requirement of a state insurance commissioner or governor of a state, like our governor-elect in Georgia, Nathan Deal, who spent 18 years in this body and left here as chairman of the Health Subcommittee on Energy and Commerce. These governors know. We'll get into a little bit of their concern about the Medicaid expansion in a few minutes, but they know. And like Representative Fleming was saying, Mr. Speaker, these high-risk pools can be set up in states, and we won't spend $6 billion of the taxpayers' money doing it, and that won't even be enough with the federal bureaucracy trying to run these high-risk pools. So, gentlemen, I appreciate that, and I'll yield back to him. If you want to engage in a colloquy with Dr. Brown, certainly he may want to ask you about that as well.
Okay. I thank the gentleman. Yes, indeed. I mean, the bottom line, what we're saying here is we can achieve all of these laudable goals without the complex bureaucracy of Obamacare. We can expand health care to many more millions of people without creating an individual mandate and an employer mandate. Certainly there are far more efficient ways, as Congressman Brown points out, that we can provide coverage to people who may have pre-existing illnesses that are already in play in many states. Excellent programs. So I'd like to inject just 2 more possible solutions to this, and then segue again into the dismantling of Obamacare that you referred to, the gentleman, other gentleman from Georgia, and that is 2 things. Number 1, health savings accounts. HSAs grew by 25% in 2009 to a total of 10 million Americans. Americans love health savings accounts. They are working. We implemented that in my own companies back home 6 years ago, and it has totally flattened out our premiums. The problem with that is that Obamacare begins to tax it as much as 10 to 20%, and believe it or not, today, of course, pre-Obamacare, you can go and buy aspirin or any type of over-the-counter medication, cold medication you want, and pay for it with your health savings account. However, in January, beginning in January, in order to do that, you got to get a prescription from a doctor for a non-prescription drug. Now, how is that going to play in our offices back home when we have hundreds and maybe thousands of citizens and patients calling us saying, I need a prescription for Tylenol so I can get it on my health savings account? So you see just how ridiculous that's going to be, and people are not going to be willing to come in and certainly pay a doctor's visit just to get a prescription for Tylenol. So that's number one. And I introduced H.R. 5126, the Helping Save Americans Healthcare Choices Act, which would restore flexible savings account and health savings accounts. I'd love to see us follow through on that. And the second point, the gentleman, Congressman Gingrey, Dr. Gingrey and I worked on was H.R. 5690. The gentleman showing great leadership on that, which is the Meaningful End to Defensive Medicine and Aimless Lawsuits Act of 2010. Once again, President Obama promised us that he would reform medical malpractice in Obamacare, and of course that was left on the cutting room floor. Once again, real solutions being ignored in favor of bureaucracy and mandates. And so with that, I'll segue back.
Gentlemen, yield back to me,
sure.
and then I'll yield some time, additional time, to Dr. Brown. I just wanted to comment, Mr. Speaker, on Representative Fleming's last remark in regard to medical liability reform that he and I have worked very hard on.